Hi, my name is Mark. I have MS. I was diagnosed with MS in 1994, categorized initially as mild. After my onset, I had only a little bit of tingling in my right forefinger and thumb. Of course, that's not the same anymore, and I'll explain later. 4 years after my onset, I had my first and only relapse in my entire history, now 16 years, almost 17 years, of MS. So after the first relapse at about 4.5 years, I began the drug therapy Copaxone, taking daily injections. And somewhere in there, I was obviously no longer relapsing remitting, but categorized as secondary progressive. So for the next 5 years or so, I took Copaxone. When Rebif was released and proven or shown to be somewhat more effective in reducing relapses in relapsing remitting patients, even though I was no longer a relapsing remitting patient, we switched to Rebif because it was shown to be a little more effective, and I took Rebif for the remainder of the time. And it was in just about the last year or so, I finally suspended taking Rebif when I went to Costa Rica to undergo a month stem cell therapy approach to try to relieve or cure MS. That attempt is documented on a blog that I will give you the link to, that you can see. That attempt for me did not turn out effective, although apparently others did get some relief and some cure from the stem cell therapy. After returning from Costa Rica about a year ago, then I did resume taking Copaxone, or rather resume taking the Rebif for a little bit, but it's kind of been off and on because obviously neither the Copaxone or the Rebif really had any effect on my course of progression of MS. Of course, it's unknown. I mean, there's no way to know whether the Rebif or Copaxone slowed my progression. There will be no statistics for that. But that said, this video is my pre-ccsvi documentation video. I am now on a waiting list to be tested for ccsvi, and if I am found to be positive for ccsvi, will of course immediately undergo the angioplasty to correct the condition. So before we go through the ccsvi treatment, I did want to document my situation now so that there will be at least some objective measurement between the before and after. To give you a description of my situation now, after nearly 16 years of living with MS, I have slowly but surely progressed and lost more and more physical capability, never having a relapse like the first and only relapse that I suffered. So it's been a slow but sure progression. So my capability as it stands now, I am essentially partially paralyzed on the right side of my body. I can no longer use my right arm or right hand. They're virtually unusable. The fingers on the right hand you see stay curled up in a curled up position, constantly, and without actually holding the right arm up, or it's virtually useless. So like a first, and I should say that only about a year ago or so, the disease finally crossed over. For the longest time, it was only the right side of my body, right arm and right leg, that were affected. I had significant foot drop for a long time, wore an AFO, walked with a cane. Now I can virtually not walk. I have to use a wheelchair mostly. I can walk very, very short distances with a cane and with help. So finally the disease has now crossed over to where now I'm getting a significant tingling and numbness in my left hand, and with repeated use, doing anything like pushing a mouse around on my desktop, the left hand will finally also fatigue and weaken and get to the point where it will not be usable until I rest a significant period of time. Another good example is eating. If I'm eating, that will fatigue the hand, and then finally it will get too tired. So for instance, here's the first demonstration, the simple palm up, palm down routine. And as you can see with the left hand, the palm up, palm down routine is not very fast. Notice the forefinger there, the middle finger drooping down where I can't really control that. And then again with the right hand, of course, the palm up, palm down is impossible. Here I'll try to do it. And that's trying to do palm up, palm down with the right hand. So there you have palm up, palm down demonstration. Now I'll do a simple demonstration where I'll just try to lift my legs, and again, starting with the right leg, trying to lift the knee. I'm seated in a wheelchair. If I try to lift the knee, even grabbing a hold of the wheelchair, I cannot move the right leg at all. The left leg, as you can see, I can still at least lift the knee and pull the foot off the floor. So there's my knee coming up and my foot off the floor, but the right leg cannot be moved. Okay, so with some help, I'll get up out of the wheelchair and get my cane, and I'll do a walking demonstration, and then that will show you how well my walking is done. And then after the procedure, we'll be able to compare if there's any difference in my physical capability.
This is my pre-ccsvi angioplasty treatment walking demonstration. And sure.